Hey everyone, it's Dr. Jason West and the Thursday night podcast coming at you from our different platforms on Facebook Live and on YouTube Live. Welcome to our weekly show that we put together, and I'm excited to share with you some neat things on arthritis. It's something that we take care of every single day. There's over 100 different types. There's osteoarthritis, rheumatoid arthritis, psoriatic arthritis, autoimmune arthritis, fibromyalgia, mixed connective tissue disease, polymyalgia rheumatica. I mean, there's 100 different types, but really there's only 5 different causes. That's something we're going to talk about. We're also going to talk about what you can do at home, some of the things that you can do for natural things for pain control, natural things that you can do, the treatments that you haven't heard about, and we're going to show with you some really neat testimonials of people that are beating their disease. And that's something that we talk about all the time in the office, is you're not your diagnosis. There's a person in there. So let's treat the person and help them to put the physiology back in place so that they get better. Now, as always, if you like what the content that you're seeing, please like and share and give us a shout out where you're from. Last week, we saw people from Australia. We saw people from, of course, Idaho. That's where we're coming at you live from. And Utah, California, Florida, our YouTube people, and then, of course, always our diehards. I want to say hi to Arnold and Robert and Cupcake Paper. I can see there's Thressa's usually on here. Just wanted to say hi to everybody. So let's get right into what is arthritis. Well, arthritis is inflammation of the joint and basically everything associated with the joint. And so when we talk about the different things for arthritis, one of the first things that I want to talk about is arthritis that is caused from joint injury and repetitive use. So what happens when someone injures a ligament, or they tear a rotator cuff, or they hurt their wrist, they jam it, they fall down and they jam their wrist into extension, and then they're saying, hey man, I'm always hurting all the time. Or they sprain an ankle, and what happens is they keep spraining that ankle over and over again. And so one of the really important things to do for that is to reset the nerves. And this is one of the most neglected things when it comes to arthritis, is the nervous system, because if your nervous system isn't working right and it's controlling the joint and it's not reset, if your body was a computer and we called up tech support and we said, hey, so-and-so's ankle, Jason's ankle isn't working really well, tech support would say, hey, turn everything off and turn it back on. And that's the neurologic control of the joint. There's a fantastic treatment that hardly anybody knows about called neural therapy, and that's a way to reset the nerves. So just like resetting a computer, if you reset the nerve supply for arthritis, you just get amazing outcomes. And we actually shot a video on neural therapy that's so important to understand. And so as we're getting ready to show this, just as a quick reminder, if you're just joining us, it's the Dr. Jason West podcast, 5 o'clock on our YouTube and our Facebook Live, and also it goes into our video library. We've been doing this for the past couple months. I think we're about 12, 13 episodes now. If you want to see those episodes, make sure that you reach out to us because they're free, and we've got some wonderful content on the different types of healthcare conditions that are coming in. So that being said, we need to review some neural therapy, and here's the video on it. I'm so excited to share with you this information. This is so neglected in healthcare, treating the nervous system specifically for nerve memory. So check it out.
If you've ever wondered what to do about chronic healthcare conditions, chronic nerve pain, or literally how to turn off your system and turn it back on, then this is a video for you. We're going to talk about neural therapy. Hi, this is Dr. Jason West, and I'm so excited to share with you a breakthrough in treatments for chronic disease, chronic pain patterns, chronic nerve problems, hormone imbalances, literally just about everything. And the therapy I wanted you to be aware of is called neural therapy. Now, how I describe neural therapy to patients in the office is it's kind of like a nerve memory or nerve dysfunction reboot system. Your nervous system has an amazing memory, and we never talk about this in the traditional medicine, and in most alternative medicine circles, we never talk about nerve memory. Let me give you an example. If you walk into your home and your spouse or your mom or your children are making your favorite thing to eat, and you walk in and you're like, wow, that smells so good. And then about 30, 45 seconds later, your body doesn't recognize the stimuli anymore, and so what happens is you don't have that same smell, and then you forget about something. You go out, get something in the car, you take your garbage out, you take your dog on a walk, you come back into your home. Wow, that smells so good. What's happening is that stimuli is coming in and your body is saying, hey, this is a new stimuli. Now, another example of how your body can get used to things or how it can categorize things differently is through something called phantom limb syndrome. Now, what is phantom limb syndrome? What happens, I have a lot of ranchers and rodeo guys that come into the office, and one of them will come in and he'll have a rope caught around the finger, and the horse or the cow will take off and he'll pull their finger off and they'll say, Dr. West, my finger is killing me. Or sometimes it'll happen in diabetics or an industrial accident where they'll have some type of accidental amputation and they'll say, my foot's killing me, even though their foot isn't there. And the nerve is telling the brain that there's still the stimuli or there's still this pain pattern. Now, if your body was a computer and you called tech support and you said, my body isn't working right or my computer isn't working right, tech support would say, well, turn everything off and turn it back on. You can reboot the system. What that does is it helps the operating system to work better, and it gets rid of some lagging programs and some memory problems inside the computer. And I jokingly tease people, look, I can't really kill you and bring you back to life, but there is a way to reboot the nerves that control pain patterns and control organ function, and that's what neural therapy is. Now, neural therapy was pioneered in the 1920s and 1930s by a Dr. Huneke, and it was written about in a German textbook called the Manual of Neural Therapy, and it's this amazing Bible that we follow in the office. Matter of fact, my book is falling apart. I use it so much because I think it's helped me be a lot better doctor. Now, what neural therapy is treatment of the nervous system and specifically addressing those nerve memory problems associated with chronic disease patterns. So if you've had a rash or you've had a surgery or you've had some type of irritation to the outside armor of your body or the skin, it can set up what's called an interference field. And this is one of the reasons why I think scar therapy is so important. If you have scars anywhere in your body, it's really important for those to get treated. And I have had some amazing patient outcomes just treating scars. Let me give you an example. I had one patient that had come into the office that had 6 lumbar back surgeries for chronic low back pain, and none of them had helped. She had tried physical therapy, she had tried acupuncture, she had tried chiropractic therapy, she had tried being active, and she was just miserable pain. And we had done everything that we could think of in the hospice, and one day out of desperation I said to her, now tell me about when your pain started. And she said, well, it started after I got a lipoma removed. A lipoma is basically a benign fatty accumulation. They did a little surgical incision on 2 spots on her back. And I said, where does it hurt? She pointed to those scars. We treated the scars and all of her pain patterns went away. It was an amazing experience that scars create interference fields and any of those chronic areas where you're having disease, and it can set up a nerve memory, and then your body accepts that for being normal. And if you reset that with neural therapy, you can get some amazing outcomes. Now, here's what you do with a neural therapy. Take a real small syringe, a little tiny dental needle, and you inject either the scar areas or the areas above the organ that's not functioning right. So you can do this for kidney problems, you can do this for heart problems, you can do this for chronic pain problems. It feels like little bee stings. It's an annoying treatment. And the medicine that you use is a glycolized ester of para-aminobenzoic acid, which is a huge mouthful. But really what it is this amazing medicine called Procaine. And what Procaine does in the right application is it makes your nerves that control the organs and the tissues open, which we call hyperpolarization, close, depolarization, and then normalize, what we call repolarization. So you can actually reset the nerves for headaches, for chronic regional pain syndrome, for sciatica, for carpal tunnel, for liver problems, for stomach problems. And we've got hundreds of patient testimonials where we use the application of neural therapy to help resolve chronic problems. Now, when you do that and you change lifestyle, you put good building blocks in the system, you get your body on a schedule, you get oxygen, you get enough water into your system, you can take healthcare conditions that didn't have any medical options, that were out of hope, were out of time, basically the patient's at their wits' end, and you can get those patients to turn around. And those are most of the people that we see in the office. We just don't have any other medical options, or we've exhausted everything, or we're tired of the prescriptions, or we don't want to do surgery. And this is a wonderful therapy if you have any of those conditions. So neural therapy is a way to reset the nervous tissue. It's been doing about 100 years in Germany. It's just starting to come to America. More and more people are doing it. It's one of the neatest treatments that I've seen in my office. Neural therapy is one of my favorite things that help people with chronic healthcare conditions patterns, chronic nerve pain, and hormone imbalance. If you see value in the video, please like us, share it, and reboot.
So one of the neat things about the neural therapy is getting those nerves to open, close, and reset. And then people are always asking, what can I do at home? And one of the first cautions that I tell them is you gotta be careful with over-the-counter medicines. They're not simply benign, and here's what I mean by that. So many times people don't feel good, they're hurting, so they go to the cabinet and they grab some aspirin. And then what happens is they start getting a lot of GI problems, and you are what you eat, and you are what you absorb. And unfortunately, aspirin is just really, really hard on the stomach. And so I want to give people some considerations of what you can do for pain control when it comes with arthritis besides aspirin. If you switch over to Tylenol, now we're concerned not so much with the stomach, but we're also concerned with what's going to happen for your liver. And so we got to be careful with it. And when people say, they come in the office, they'll be like, hey, I can control the arthritis. Well, what are you doing? Well, I just take 6 or 8 Tylenol every day, or I just take 6 or 8 acetaminophen or Aleve or aspirin. And I just want to urge caution on there. No one wants to live in pain. I mean, I've had an episode of kidney stones, and I'm so thankful that there was something that you could do for pain, because I wanted to die and I was scared I was going to live. It hurt so bad. And I'm so grateful that I was able to have something that got me over the Grand Canyon, that big chasm of pain and discomfort. But it was a temporary thing. Now, when people start saying, okay, what should I do? What are the best things that I can do? So let me give you some examples. My favorite thing to do for pain is to do essential fatty acids and proteolytic enzymes. So what that means is omega-3s, 6s, 7s, and 9s. You want short chain, medium chain, and long chain fatty acids. And if you combine that with enzymes that help to get rid of inflammation, what it does is you can get a really nice arthritis effect without chewing up your stomach or hammering your liver or your kidneys. Now, essential fatty acids, so fish oil, olive oil is really good, avocados, coconut oil, natural peanut butter, and I have no vested interest or anything, but I'm a real big fan of Adam's peanut butter. So it's the natural peanut butter, and if you let it sit for very long, it starts to separate. That's good. That means that we've got the right kind of essential fatty acids in there. Now, some people are allergic to peanuts and they can't do peanut butter, so that's just one example. But those things, flaxseed oil, GLA, evening primrose oil, if you combine those, now I like to use a product called Ultimate Omega that combines all of them in one system. You can get that at our store, Personalized OTC. There's a link here that if you want to check this out. Now, you don't have to get it from me. I don't even care where you get it from. Just make sure it's a high quality oil. And then you want to mix it with a proteolytic enzyme. That means an enzyme that helps to chew up inflammation. And I like to tell people, look, if you'll take it on an empty stomach, what happens is it acts like little Pac-Man and it'll eat up inflammation. Now, you just have to combine those essential fatty acids, proteolytic enzymes, and what happens, you get a wonderful pain control effect. Now, here's the warning with that. There's no side effects. There's no bad things that are going to happen. It just doesn't happen very fast. It's not like you pop an aspirin and 30, 40 minutes later, you're feeling better. The essential fatty acids pathway that is so effective for people usually takes about a week to kick in. And if you'll keep taking it, there's just some amazing therapeutic benefits from that. So enzymes and fats, that's one of the first things I tell people. Now, some other things that are really good for naturally mopping up arthritis. One, be really careful with your sugar intake. And this is why we did a free sugar report. If you haven't seen the report, you can DM us right in the comments and we'll pick it up. If you'll just do #blood sugar. Sugar is the key to managing inflammation. Now, it's not so much fruit sugar from, apples or oranges or grapes or strawberries. I'm not worried so much about that sugar. It's refined white sugar, it's high fructose corn syrup, and it's artificial sweeteners. If you make a conscious effort to reduce your intake, while improving your essential fatty acids and your proteolytic enzymes, wow, you can get an amazing jump on natural pain control without having to do some of the prescriptive pathways or over-the-counter medicines. Now, we've put this all together in a program that I'm going to tell you about in just a little bit, where we actually have taken some collagen peptides. It's in a product called Joint Freedom, and you can just see the link here in just a minute, in Joint Revive. That's what I've put together to help people, but no one wants to live in pain. There's essential fatty acids, proteolytic enzymes. Now, some foods that you can eat. One of the best things you can do is raw pecans, about 6 to 8 raw pecans every day, have some really nice neutralizing effects on some stuff that gets into the joint that causes osteoarthritis or the bone-on-bone arthritis, called guanidine. Now, guanidine is a really alkaline substance. It gets attracted into the joint, and it's literally like putting rust in there. And so what happens is pecans help to get rid of the rust. And this is something that my grandfather taught my dad taught me, is when people have arthritis on their fingers, we call those Heberdain's nodes, or an x-ray, they call it a gull wing deformity. They start to get enlarged PIP or DIP on their knuckles. That's the joint reference. Pecans help to mitigate those deformities, also called Heberdain's nodes. Now, it's important that it can't be it has to be raw pecans. It can't be candied pecans or chocolate dipped pecans. Or for heaven's sakes, it can't be pecan pie. But pecans are fantastic foods for arthritis deformation prevention. They're really good for that. Another thing that's really good for arthritis pain at home is raw pineapple. It doesn't seem to work so well if it's dried pineapple or pineapple out of a can. But raw pineapple, if you take a pineapple, cut it up and eat it as quickly as you can, what it does is it has some enzymes in it that help to neutralize the inflammatory effects of arthritis. Another one that's really famous or really well known for the arthritis, basically metabolic arthritis, is gout, is raw cherries. Now, I tell people the nice trifecta for foods for arthritis is pineapples, it's cherries, and it's raw pecans. Kind of that three-headed monster is just fantastic for natural pain control. Now, there's some other things that I think are really good for arthritis. One of them is to make sure that you're digesting your food adequately. And the Vermont folk medicine is to use apple cider vinegar. I like actually Bragg's apple cider vinegar. And again, they're not, a sponsor of the program or anything. I don't have any financial interest over there or anything associated with that. But Bragg's apple cider vinegar, I've seen really good outcomes in helping chronic arthritis. And then some treatments that are available. So a lot of times doctors don't know about this. They're just not taught about it. I didn't learn this in school. I learned it when I got out of school. But there's a couple really neat things. The red bed therapy to get ATP energy into the body. There's vitamin infusion therapy with vitamin C and magnesium. And I think the most important vitamin to help with pain and inflammation is vitamin B6, also known as pyridoxine. Vitamin B6 is amazing for pain control and inflammation. And one of the reasons why it's so important is it makes vitamin C work. So if you're just picking us up on the program, it's the Dr. J podcast. Thursdays, 5 o'clock on our different channels. We also have all of our shows archived. If that's something interesting, please DM me about the archive shows. And we have a couple things that we're giving away. One is the blood sugar report. And then also we're talking about arthritis. There's a link that we're putting together that talks about what programs I've put together or things to do to help people. It's in a company called Personalized OTC. One of them is called Joint Freedom. It's a collagen peptide, which helps to nourish basically the soft tissue around the joint. There's not only ligaments around the joint, but there's cartilage and there's connective tissue associated with the joints. And then also we're going to talk about the fire extinguisher, the garbage collector, and a product called Joint Revive in just a minute. Now, I wanted to show you that the rubber hits the road. I want to show you Patty's story. This is one of my favorite patient experiences because she couldn't function before, and now she can function now. and play, get on the floor and play with her grandchildren. So check out Patty's story.
Hey everyone, Dr. West and Patty, just really excited to have her share the story of how she came into the office and how she's doing now, because we did the reevaluation. Her blood's looking great. She's feeling great. There's little things we need to tweak, but it's this cool story. So Patty, tell everyone what it was like why did you come into the office?
Oh, it was actually very terrible because I had psoriatic arthritis, and I was basically hooked to my chair, and I could hardly move at all. I could hardly even function. Just to breathe in some days was painful. It was truly horrible. I remember sometimes I'd wake up in the mornings and just open my eyes, and the tears would just come. The tears would just come because the pain was still there. It just never, ever went away. And, they talk about hope here. And I can't even tell you how true that is, that they actually give you hope. I never dreamed I'd ever be able to feel like this again. I just never dreamed I'd ever be able to feel like this again. To be able to just get up and to move around and to do things with my grandkids and my kids and my husband. It has truly just been a miracle. It really has for me. I had a little grandson that's 4 years old, and he loves to get down and play cars. And I remember him saying the one time, "Grandma, will you come down and play with me?" And I'm like, "Yeah, I think I can." And to be able to get down on that floor by myself and to push the cars around and to play with him for probably about an hour, and then to be able to get up by myself. It wasn't pretty, but I was able to get up by myself. It was truly amazing. It was so amazing.
And so, Patty, everybody's want to know, okay, what was the secret sauce? What do we do? So the treatments that we did, you changed some lifestyle things, which are huge. We put you on a supplement program based upon the findings that we found on your blood tests. But what do we do in the office?
Well, they gave you the IVs.
So we did some vitamin infusions.
Yeah,
and then we did some injection therapy.
Yes, and the injections. And at first, those injections were painful. That was not fun.
Okay, we'll edit that out.
But
I'm just joking. They do hurt.
Yes, yeah, but they get better. The first one was really hard, and stuff, but they get better, and you almost are looking forward. Truly, you're looking forward to getting those shots because of how much they help. They really do make a big difference.
So we did a series of those, and then something really neat for me, because I always want to make it that people don't need the office. So we did a reevaluation today, and Patty, what did we see?
Oh, my blood looks great. I'm a cancer survivor, and we didn't see any signs of cancer in my blood, and everything looks pretty good. So I'm very excited about that.
Yeah, it was really neat. So really from here, it's just tweaking. We want to help her clean up a little bit of the residual stuff, but we don't need to do a big overhaul. It's just, hey, you're doing really well. And when we saw her come in, she just beams. and before, it was kind of like, hey, there was a battery that didn't have a charge to it, was really how it was. And that's why people get sick, is they run out of energy. And then for Patty to say, and she told me the story about her grandson before, to say, I was able to play cars with my grandson. It was just awesome.
Yeah.
And I went home, and my wife's like, how would it go today? I'm like, you wouldn't believe it. I helped someone play cars. And she kind of chuckled, and I'm like, but you don't understand the backstory. So
it's true.
Anyway, so Patty's okay if I put this up for people to get some hope?
You bet.
So this is Dr. West and Patty signing out. Daily Dose Vitamin H at the West Clinic. She's one of my heroes. She had a sickness. We're winning. It's really fun to be a part of. We'll see you guys on the next video.
Thank you.
So the things that we did for Patty was to balance the body. That's so important, to make sure that you're getting the most important vitamin and the most important mineral for arthritis, which is the one that you need. So in part of our workups, we're doing what we call a Nutritional Index, making sure that you're eating healthy. One thing that I'm excited to tell people is I did write a new little book called The Clean Eating Guide. Whoops, right here, I'm sorry. The Clean Eating Guide. And if you'd like this, if you'll, again, direct message me inside of the program, the Clean Eating Guide, it tells you about how to get food that's healthy for you to taste good. And this is really, really important, because no one wants to eat boring, bland food, or at least most people don't want to eat boring, bland food. So inside of the book, most of it is healthy foods and how to make those healthy foods taste really good. It reduces inflammation. That's why we call it the Clean Eating Guide. It's an essential part of our arthritis program. And just so you know, it's not just Patty's story that we're talking about. There is a process inside of arthritis treatments that people need to know about called regenerative injection therapy. And inside of the clinic, we do a couple different things with that. One of them is to do Prolozone Therapy. It's proliferative therapy using oxidative medicine. And let me show you this little clip and talks all about Prolozone Therapy.
Hello everyone, Dr. Jason West with some ideas about arthritis, about bone-on-bone arthritis, chronic knee injuries, chronic hip problems, back problems. It's this wonderful therapy called Prolozone Therapy, and here's how I was introduced to it. I had a patient that was coming in the office that was getting adjusted consistently, but the adjustments just really didn't hold. And he went and saw a doctor in Nevada that did a Prolozone treatment on him. It helped to stabilize the ligaments so that the adjustment hold, and he told me about it. I went and learned from this doctor about how to do this amazing therapy that helps with arthritis. Now, most of the time when people have arthritis, it's really like they have a rusty hinge. The joints don't move very well. You get chronic inflammation into the joint. It hurts to do activities of normal daily living. It can be inflamed, it can be hot, it can fill up with fluid. I mean, all of these things are associated when there's not enough space in between the joint surfaces. Now, typically the medical treatment for that is they do a series of cortisone therapy, or eventually you may end up with some type of surgery, a hip or a knee replacement. And this isn't an anti-medicine video, but there's so many things that you can do before you have to get surgery. Now, one of the most common things medically they do is some type of cortisone injection or maybe a Synvisc type injection. And I like to tell people, I'm kind of joking and kind of serious when I say this, if you're driving down the road and you look down in your car dashboard and you see the oil light come on, you know something that is going wrong with the car. And the medical community gives you a piece of black electrician's tape, you put it over the oil light, and voila, you have no more oil light problems. Common sense tells us that we're going to end up with a major overhaul if we don't fix the problem, and this Prolozone therapy is a fantastic way to fix it before you need a great big overhaul. Now, what is Prolozone therapy? It's a proliferative therapy using vitamins and minerals and some oxidative medicine that actually make the tissues heal. So it's actually a semi-permanent restorative type therapy. So here's how you do the therapy. You take a little syringe with a little tiny needle on it, and you can actually take a vitamin solution and inject the joint surfaces, inject the ligaments, and inject the muscles around the area. Put in the building blocks, and you tap into the body's restorative medicine abilities. Now, when I talk about restorative medicine, if you bump up against something and you get a bruise or you cut yourself, the body sends the immune system and the healing cells to that area to heal up the problem. Now, the same thing happens when you get a new stomach every 10 days, you get a new liver about every 3 months, you get a new bone system about every 6 months, and proliferative therapy using oxidative medicine, the Prolozone therapy, just taps into your body's ability to heal itself. It's a little bit different than taking an oral supplement like glucosamine or chondroitin or papaya or bromelain or any of these natural over-the-counter medicines or therapies for joint pain, because this actually puts more of the building blocks directly in the area. I think it works a lot better. Now, I haven't had any problems with contraindications. I love using this natural approach because the worst thing that usually happens with people is that they stay the same. You can't make people worse. There's no side effects. It's not like putting cortisone therapy where you can't do as many treatments as it possibly needs because it knocks down the inflammatory systems and it actually can damage the bones and the ligaments. I've had people where we've been able to do this repeated times over the last 10, 12 years, and we don't have any problems because we're just putting natural things into the area. Some really, really neat outcomes of people that can't walk upstairs, they can't throw a baseball, they can't golf, they can't fish, they can't garden, and we do this restorative therapy and they get their life back. Now, what's really neat about this is it's really cost effective. Usually the treatments are anywhere from $150 to $300, and so if you're looking for a healthcare provider that's doing this, that's usually the price structure that you're looking at. You're looking at about 3 to 5 different treatments, and then usually you have to do a follow-up treatment about every 12 to 24 months. So it's a really neat long-term solution where you don't have to use drugs or you don't have to use surgery for your arthritic conditions.
Now, I love doing this therapy. It works on carpal tunnel. It works on back conditions. It works on herniated discs. I've seen it work amazingly well on ankles. One of the testimonials that we did a couple months ago was on Karen, how we had saved her foot literally from amputation, an old injury. And then because the ligaments were solid, what happened is the foot kind of curled underneath it. And she's had an amazing outcome. And what it does is this really helps to shrink wrap ligaments. So if you've had a separated shoulder or a rotator cuff or a chronic sprained ankle, this is something that is really, really important to know about. And matter of fact, I'm getting ready to show you Bruce's story. Bruce comes down to the office from Canada, chronic neck problems, couldn't function before, and check out Bruce's story.
You've come a long ways.
Yes, it is. Well, actually, this started quite a number of years ago now. A friend of ours from Twin Falls got me started on it, and he was basically sitting in his chair waiting to die, and a friend of his got him to come to Dr. West when he was a kid, he'd broke his ankle, and he got to where he couldn't walk. And when a friend of his got him to come down to Dr. West, and they injected his ankle with Prolozone, and the next morning he walked out of his house, walked a half a mile to his mailbox, got his mail, and walked back in again. He hadn't done that in years. So that convinced me. And I've been coming down, I guess probably this is 6 years now. And I get shots in my shoulders and my neck, my back, and mostly it's for arthritis. And it's just been wonderful. I can't say enough for Dr. West on this. I mean, they've made my life to where it's basically manageable again.
So I love this approach because it's a totally natural thing to do. And when I say natural, it's vitamin B12, it's para-aminobenzoic acid, it's a little bit of a refined sugar solution called 5% dextrose. And what it does is you put those building blocks in the area, it strengthens ligaments, it helps connective tissue, it helps the joints. And we see consistent outcomes just like this. So if you're just joining us, we're talking about arthritis. It's the Dr. Jason West live program every Thursday night at 5 o'clock. One of the things we've been talking about is the clean eating guide. I've picked it up wrong a couple times. It's how to eat clean so that you get foods in your body that taste good, that reduce inflammation, because inflammation is such a key factor in arthritis, for fibromyalgia, for mixed connective tissue disease, polymyalgia, osteoarthritis. Another thing that we've been talking about is the different ways to help people naturally with supplements, and I'm going to share with you this thing that I put together. It's called Joint Revive, and what's really neat about Joint Revive is it's how we literally can keep people from sliding back. So you get people out of pain for arthritis, and then you want to maintain them. And so one of the things that's really important is managing inflammation with like vitamin B6, curcumin, boswellia, proteolytic enzymes. They act like little Pac-Man. They eat up inflammation inside the body. And then you want to make sure in the natural products that you're taking that you have a shock absorber. And so that's things like collagen, glucosamine, chondroitin. My favorite arthritis natural recommendation is something called acetylmyristoyl. It's abbreviated into CMO, and this is like supercharged glucosamine. It works so well to give your joints a little bit of extra shock absorber, and then you've got to have something that gets rid of the poison. So chlorella, lymphatic drainers. I like a sugarcane extract called Wilson factor, and then you got to lubricate the joint. So that's the essential fatty acids. They may be the single most important dietary supplement for overall health, but it's so good for protecting the nerves. It's really good for insulating the brain, and it's really helpful for your pain pathways, and then a sanitation engineer. So what this product is a combination of a fire extinguisher, a shock absorber, a poison remover, a lubricator, and a sanitation engineer. Joint Revive is down here in the links if that's something that you're interested in. There's certainly different options on the market that you can be aware of, essential fatty acids, turmeric. Please don't underestimate the effects of vitamin B6 in arthritis. It's so important for making vitamin C work, which is donating electrons to the body, but it's also a really nice vitamin anti-inflammatory. Another one that I'm really excited to tell you about is the regenerative injection therapy, where you can actually inject those substances in and around the joints so that we can get them to remodel. You can reprogram the nerves. If you're just joining us, we showed a clip before, so make sure you watch it from the beginning about this amazing therapy called neural therapy. And I want to show you someone that traveled to the office from Arizona. He had chronic knee problems, back problems, neck problems. He'd been to a whole bunch of different doctors before he'd get relief at the clinic. And it's Russell's story. And my friend Russell Webb, check this out. Here's his story.
About 14 years ago, I injured my back really badly. Went to multiple chiropractors and doctors, never was able to get relief from the pain. As a youth, I've had problems with my knees ever since high school, and all of these problems continuing to get worse. A relative of mine had come to see Dr. J and suggested that I might come up here and get relief from some of the pain I had. And so I was willing to, at that point, because the pain was so bad I couldn't sleep at night. My back hurt so bad I would have to prop pillows up under my legs and my back to kind of position my body into a V to take the pressure off. And when I could do that, I could sleep probably 3 or 4 hours, but that was it. I came here to the clinic and explained what was wrong, and they've gave me some treatments that definitely helped. When I was much younger, I had a condition called Osgood Slaughter's disease, which is, as I understand it, and I'm probably getting this wrong, your bone actually grows faster than the muscle, and it causes a pulling of the muscle against the bone and where the muscle's attached to the bone. The muscle tore free from my leg in my knee joint and ripped a chunk of bone loose. They reattached that and then casted me for 6 months, which caused huge problems with muscle atrophy and other things. The pain never completely went away. I continued to play high school sports and other things that probably weren't good for it, and I've just lived with that my entire life. That was one of the major problems I was having when an uncle of mine suggested I try this, and after I came to see Dr. J and had the Prolozone injections, I was completely pain-free within hours of the treatment. That was about 18 months ago. The pain started coming back. So I came back for another treatment, and it's solved the problem again.
You've had to run into a lot of skepticism.
A
Tell me
lot.
about that.
I've sent a lot of patients up here to see Dr. J in his clinic. Every time I tell someone about my story and tell them, they get that look like, really? And all I can tell them is, it works. I'm proof. That's it. Every person I've sent here has had the same positive results. My parents, many other family members, friends. I think the number's totaling close to 30 now. Every single one of them has had positive results. Would recommend this just like I would. I don't know the science behind what the treatment is. I know the names of the things that he injects into me, but it works. That's the only thing I can say about it.
So when we start talking about arthritis, it's inflammation of the joint. Arth means joint, itis means inflammation. There's over 100 different diagnoses, but there's really kind of 5 types. There's repetitive stress arthritis, if you're doing the same thing over and over again, working on an assembly line, if you're out doing the same gardening, if you're doing a lot of painting and stuff, you're doing that whole thing with the repetitive stress, you can irritate the ligaments in the joints. Obviously, one of the options for that is to try and get your body to do it a little bit differently or to change activities. But the things that are associated with that, essential fatty acids, vitamin B6, glucosamine, chondroitin, and apple cider vinegar are really good. I also think it's a good idea at home when you have repetitive stress to do a pulsating therapy with heat, cold, and rest. And again, this is one of those things that's really underrated, but you get amazing outcomes with it. Hot for 10 minutes, cold for 10 minutes, rest for 10 minutes. So a heat pack, ice pack, and rest. You can do this for shoulders. You can do this for ankles, for knees. Baths work pretty well if it's really hot. And then also you can use a cold packs afterwards, creates a pumping mechanism. So that's one, a repetitive stress arthritis. The other one that you see a lot of is traumatic arthritis, where people have an injury or a surgery on a joint, and it's never quite the same. And part of that is because the nervous system isn't working the way that it's supposed to. And so what we do is we can reboot the nerves. That's the neural therapy segment. Another one is autoimmune arthritis, where the body gets tricked into thinking that there's bad substances or bad cells in and around the joints, and so the body goes and attack it. This is something like rheumatoid arthritis, or fibromyalgia is considered by some to be an autoimmune disorder, or something called Sjogren's disease, which is when you lack lubrication for the joint, you get inflammation. So those are your autoimmune arthritis, and I've found that there's almost always an infection component associated with autoimmune arthritis. It could be Lyme disease or chronic staph infections, and then Epstein-Barr. And this is one of the things that we're going to talk about in our upcoming segments is Epstein-Barr virus. And it's so prevalent and it's so misunderstood. And most doctors look at your test and be like, well, it's not an acute Epstein-Barr. It's a chronic, which means you're exposed to it. So it's just in your system, and, get more rest, eat healthier. That's not the way to treat Epstein-Barr. The way to treat Epstein-Barr is to work on your cell-mediated immunity pathways, particularly your thymus gland. There's a way to nutritionally support that, and to work on the nerve supply that goes to your thymus gland, and your blood reservoir, also known as your spleen, which incidentally seem to be the two most neglected organs in traditional medicine, the thymus and the spleen. So there's a huge component of autoimmune arthritis in the infection pathways. Also talking about metabolic or stomach arthritis. You are what you eat, you are what we absorb, and there's certain foods that really irritate people, get their stomach all irritated. And guess what? If you have arthritis, almost always people have a stomach problem, because the cell trauma from arthritis usually causes the bowels to not work right, almost always in the case of constipation. So if your sewer system isn't working right, you are not working right. And so one of the important things to do is to help people. If you're having bowel problems and your joints hurt, let's help you to stimulate the liver and the gallbladder access. Let's get you some bile salts. Bile salts, what it does is it helps to get the conveyor belt to move more consistently. So when food goes into your system, it's supposed to be broken down. It goes through about 40 feet of different parts of your GI system. It goes into your colon, and that's where the water and the vitamins and a lot of minerals are absorbed in the last part of the colon, and then it exits the body. When people have a lot of cell trauma or inflammation from arthritis, so many times people are constipated, and then what happens is they can't absorb those vitamins and minerals and water in the last part of the colon, and what happens, the sewer system's off, and it just causes more cell trauma, and guess what? We have this vicious cycle all over again. By the way, this can be really aggravated by over-the-counter medicines or pain-relieving medicines, and so that's this vicious catch-22 cycle. And so there's things that you can do to really make the gallbladder and the liver to work better. And a lot of people don't have gallbladders because they've been removed. So now we got to focus a little bit harder on the liver to get it to secrete bile, so that what it does is it helps the GI system. And so the different types of arthritis is repetitive stress, wearing out, trauma, autoimmune, and then your GI system arthritis. Now, I put together a nice little program on the clean eating guide of how you can get foods into your body that are really helpful for arthritis. 1 is pineapples, 2 is cherries, 3 is pecans. I'm also telling people essential fatty acids is really good for you, proteolytic enzymes, glucosamine, curcumin, turmeric, vitamin B6 are really important. Collagen peptides give you shock absorber capabilities. And so I put it together in a nice little product system. 1 is called Joint Revive, and the other one is called Joint Freedom. And what this does is it helps to get inflammation out of your system. And then the treatments that most people don't know about. So you have the regenerative injection therapy, which includes Prolozone and prolotherapy and perineural injection therapy and neural prolotherapy, which are all a bunch of big words. It's basically how to get nutrients in and around the joints so that they can heal. That's one consideration. There's vitamin infusion therapy. There's ultraviolet blood irradiation therapy that's a really important consideration. And then also making sure that you're eating foods that reduce the inflammation that's inside of your system. And now I've got tons of these video outcomes of patients that have gone through the program over on our video blog, Daily Dose Vitamin H. We've also combined the programs that we've talking about in the Dr. Jason West live program. Once, incidentally, I'm so excited, September 14th, I'm doing a bunch of Fox News contributions on different healthcare considerations. I'm going to be all over the nation Friday, September 14th, and we're excited to share that with people. And then also how to help people by improving their dietary intake. And again, that's why we have the clean eating guide. If that's something that you would like, please let me know, DM me, clean eating, hashtag clean eating in the comment section. Please like and share the video so that we can help people to know their options and outcomes when it comes to arthritis. We're really excited to share that and improve the platform and education for people that are suffering. This is the Dr. Jason West program. It's Thursdays, 5 o'clock, that we stream out. We've also have a library of the different topics that are associated. Next program, we're going to talk about Epstein-Barr. We'll also have a really neat Arthritis University, a free masterclass where I have tons of content. There's a whole bunch of different sections, the different arthritis types, the treatments you haven't heard about, what you can do at home, the foods that you should eat, the natural supplements that you should be aware of. It's a free masterclass that we're coming out with. And it's something we've been working on for about 1.5 years now. So I'm excited to share that. If you're interested, make sure that you post a comment. Please tell me where you're from. A big shout out to all of the people that are supporters of the program. Again, Robert and Arnold and Theresa and Stephanie and James. Thanks you guys for your support. This is Dr. Jason West. Next week, Epstein-Barr. I'll talk to you guys later.